Welcome. In this video, we'll be exploring pulmonary hypertension, a serious condition that affects the arteries in your lungs and the right side of your heart. We'll delve into what causes it, how it affects your body, how it's diagnosed and treated, and what you can do to manage this condition. Pulmonary hypertension, or PH, can stem from a variety of underlying causes. Some individuals inherit genetic mutations that predispose them to the condition. Others develop it due to other medical conditions, such as congenital heart defects, connective tissue diseases like scleroderma, liver disease like cirrhosis, HIV infection, chronic lung diseases like COPD and pulmonary fibrosis, and even sleep apnea. In some cases, the cause remains unknown, a condition referred to as idiopathic pulmonary hypertension. To understand pulmonary hypertension, imagine the pulmonary arteries as busy highways carrying blood from the heart to the lungs. In PH, these highways narrow and thicken. This narrowing increases the resistance to blood flow, forcing the right ventricle of the heart to work much harder to pump blood through the lungs. Over time, this increased workload causes the right ventricle to enlarge and weaken, eventually leading to right-sided heart failure, also known as cor pulmonale. The lack of efficient blood flow through the lungs also means that less oxygen is picked up, resulting in symptoms like shortness of breath and fatigue. Pulmonary hypertension can affect people of all ages, races, and genders, but it is more common in women than in men. It is estimated that tens of thousands of people in the United States are affected by pulmonary hypertension, and the actual number may be higher, as the condition can be difficult to diagnose. The prevalence varies depending on the underlying cause of PH. For example, PH associated with connective tissue diseases is more common in people with those specific conditions. The signs and symptoms of pulmonary hypertension can be subtle at first, often mimicking other common conditions. Common symptoms include shortness of breath, especially during exertion, fatigue, dizziness or fainting, chest pain, swelling in the ankles, legs, and abdomen, and a bluish tint to the skin or lips, known as cyanosis. As the disease progresses, these symptoms tend to worsen and become more noticeable, impacting daily activities. It's crucial to consult a doctor if you experience these symptoms, especially if they persist or worsen. Diagnosing pulmonary hypertension requires a comprehensive evaluation. The process often begins with a thorough medical history and physical examination. A key diagnostic tool is an echocardiogram, which uses sound waves to create an image of the heart. Other tests may include a right heart catheterization, the gold standard for confirming the diagnosis and assessing the severity of PH, pulmonary function tests to evaluate lung function, blood tests to look for underlying causes, a ventilation perfusion scan, or VQ scan, to check for blood clots in the lungs, a CT scan to provide detailed images of the lungs and blood vessels, and a sleep study to rule out sleep apnea. Pulmonary hypertension is classified into 5 main groups based on the underlying cause and similar characteristics. Group 1 is pulmonary arterial hypertension, or PA, which includes idiopathic patch and PA associated with certain genes, drugs, and other conditions. Group 2 is PH due to left heart disease. Group 3 is PH due to lung diseases and/or hypoxemia. Group 4 is chronic thromboembolic pulmonary hypertension, CTPH, caused by blood clots in the lungs. And Group 5 is PH with unclear and/or multifactorial mechanisms. Understanding the specific group is critical for determining the most appropriate treatment strategy. While there's currently no cure for pulmonary hypertension, treatments are available to manage symptoms, slow the progression of the disease, and improve quality of life. Treatment options vary depending on the classification and severity of the condition. These may include medications to relax and widen the pulmonary arteries, such as prostacyclin analogs, endothelin receptor antagonists, and phosphodiesterase 5 inhibitors. Diuretics can help reduce fluid buildup. Anticoagulants may be prescribed to prevent blood clots. Oxygen therapy can improve oxygen levels in the blood. In severe cases, a lung transplant or pulmonary thromboendarterectomy, a surgical procedure to remove blood clots from the pulmonary arteries, may be considered. Lifestyle modifications, such as regular exercise, a healthy diet, and avoiding smoking, are also important components of management. Unfortunately, there's no definitive way to completely prevent pulmonary hypertension, particularly in cases where it's caused by genetic factors or underlying medical conditions. However, you can take steps to reduce your risk. Maintaining a healthy lifestyle, including regular exercise, a balanced diet, and avoiding smoking, is essential. Promptly treating underlying conditions such as sleep apnea, lung diseases, and connective tissue disorders can also help. Regular check-ups with your doctor can help detect PH early, when treatment is most effective. The prognosis for pulmonary hypertension varies depending on the severity of the condition, the underlying cause, and how well the individual responds to treatment. Early diagnosis and prompt treatment can significantly improve outcomes. Researchers are actively exploring new therapies and treatment strategies, including gene therapy and novel drug targets, to further improve the lives of those living with pulmonary hypertension. Stay informed about the latest advancements and work closely with your healthcare team to manage your condition effectively.